Hello, everyone. Good afternoon. Thank you very much for joining us at the webinar today. I'm very excited to see that the room is indeed filling up. And I will promise it's going to be a wonderful time this beautiful Saturday evening. All right. As you're aware, the topic for today is from the wardroom to the boardroom. So I expect that this room is going to be filled with a lot of medical professionals, health practitioners across the nation, across Africa, who are interested in understanding the business aspects of the medical practice. And of course, every industry has its own technical side and business side, and we're really going to be digging into the business side of the healthcare system, of the healthcare practice in today's webinar. I'm proud and I'm excited to be your moderator. My name is Dr. Dolapo Amuson, and I'm pretty sure you're going to have a very, very good time. So first off, on the agenda today is that I'm going to hand over to Chinedu Ewuzie, who will give us an introduction and a welcome address. Over to you, Chinedu.
Hi, let me just share my screen.
Awesome.
Can you hear me?
Yes, we can. I'm sure everyone can.
Can you see my screen?
Yes, we can. Please go ahead. Thank you.
All right, great, fantastic. Thanks, Dolapo. So, good evening, everybody. You're welcome today to the LBS MBA Industry Spotlight Series. So today we're focusing on the theme from the wardroom to the boardroom. Like Dolapo said, this has been specifically tailored towards professionals in the medical industry. So my name is Chinedu Ewuzie, and I am the MBA director at Lagos Business School. So basically, I just want to take us through a 5 to 7 minute presentation to talk about why we're here and what to expect in the discussion. So the webinar forms part of our LBS MBA Industry Spotlight series, which is basically designed to provide professionals with business management skills. So we also showcase how industry professionals can combine their specialization and practice with degree-level business education. So basically what we're saying is, what we're trying to answer here is, how do you combine your backgrounds, your medical sciences, pharmacy, med lab, how do you combine that background with a business degree, and what can happen when that combination takes place? So today's webinar, we will explore the journey from clinical practice to healthcare leadership, and we will learn what it takes to move from the word to executive boards. How do we move from the operational part of the business to now occupying executive positions where we're discussing things such as strategy? And how do we overcome challenges and succeed in leadership roles in the healthcare industry? As we know, leadership is quite different from the operational part of the business. So in this webinar, we're going to be engaging with our participants and also our guest speakers and panelists to discuss these things. What are the challenges that you have moving from core operational roles to more strategic and leadership roles? We're also going to be talking about the key skills. What are the experiences that you go through, and what are the insights that you require? Healthcare contributes to the growth and development of the Nigerian economy. Some people put it at a minimum of $95 million annually. Some people put it at more. But the key thing is the sheer number of professionals working in the industry. Some records say that we have about 24,000 professionals working in the industry. And we know that the healthcare industry is a key driver of economic growth, job creation. And of course, with a growing demand for healthcare services and the increasing need for investment in healthcare infrastructure, government initiatives, rising awareness, is basically re-emphasizes the importance of healthcare. There's a clear link between the quality of healthcare and GDP, job creation, quality of life, and attraction of foreign investment. And these are things that we quite often see. So what is required is basically a combination of the government and private sector working together to invest in the healthcare sector to drive economic growth and improve. But to drive this growth in the sector is really going to be driven by primarily healthcare professionals. And they are the ones who have the better understanding of the healthcare challenges. So those of us who are outside the healthcare industry don't have as much insight into the pain points that the industry faces. They are the ones that are better equipped to make decisions. They are the ones that are better equipped to guarantee improved patient outcomes. And of course, they're the better people to collaborate with, because of course they have both the operational side and the strategy side. But what are the challenges that are facing healthcare professionals today? Limited healthcare infrastructure, shortage of healthcare professionals, high cost of healthcare services, inadequate funding, poor distribution of resources, lack of access to essential medicines, and many, many, many more. But the question becomes, how do you turn these obstacles into opportunities? And what are the skill sets that you require? And that's what we're here, or part of what we're here to discuss. Now, these challenges result in increased workload, stress, decrease of job satisfaction, and we can clearly see by the number of healthcare professionals who are leaving the country constantly. But to address these challenges, you require sustained effort to improve healthcare infrastructure, to increase the number of healthcare professionals. And the thing about being a professional, there's the core part of the operations, which of course is covered by the degree and the experience we have as doctors. But there's now, to be a professional, there's now the management side, which is really what we're here to talk about. But one way to, in addition to all the other ways to overcome the challenges, is really what the role of business education does. So business education can help healthcare professionals overcome challenges they face by providing a well-rounded education that combines business management skills, core technical skills, and experience. So in other words, you need to be able to discuss the core business disciplines. As a leader, business leader, even as a doctor, even as an engineer, even somebody who studied accounting, you need to be able to discuss the core business disciplines, finance, strategy, operations, human resources. You need to be able to make improved decision making and problem solving. Just before the start of this session, one of the panelists was telling us of all the challenges that he had to face in his organization. So you see, as a healthcare professional, in addition to making decisions about your medicine, you need to constantly keep making business decisions. You need to be able to navigate complex systems and regulations. You need to understand, like I said, the financial and operational aspects of healthcare organizations. You need to be able to identify and capitalize on opportunities. Like they say, all the obstacles in Nigeria actually represent opportunities. So the question now becomes, what are the skill sets we require to turn those disadvantages into opportunities? But by investing in business education, healthcare professionals can develop the skills they need to make informed decisions, solve problems, lead and manage organizations effectively. As a chief medical director or assistant chief medical director, what you are essentially is a leader. And there are certain dynamics that come with being a leader. You need to understand those dynamics to drive growth and development in the healthcare sector. It helps have better chances to succeed in emerging healthcare environment and drive growth and development in the healthcare sector. Like I said, there are many opportunities that we see, but the question now becomes, what are the skills and resources that you require to take advantage of these opportunities, and also the networks. So there are many opportunities in healthcare, right? We can clearly see medical technology, pharmaceuticals, health insurance, medical tourism. Telemedicine is growing at a very fast rate. Health management and wellness. So we're seeing wellness centers pop up in different areas, catering to different areas of wellness. So the many opportunities are abound, but the question now becomes, what are the skill sets that we require to take advantage of these opportunities? So the good thing is that there are many examples of doctors and other healthcare professionals across Nigeria, Africa, and the world who have leveraged both the benefits of having an MBA degree with also their background in medicine or pharmacy or med lab or generally any degree in healthcare. And these doctors have used their financial management leadership skills to drive change in the healthcare industry, becoming effective leaders and decision makers in the field. So whether they work in public or private sectors, they demonstrated the potential of an MBA degree or an advanced business degree and how it can help doctors or medical professionals become more effective and impactful in the healthcare industry. And today we're fortunate to have some of these doctors with us today. We have Dr. Olayinka, who has just completed his executive MBA program at the Lagos Business School and is the Chief Operating Officer for QLife Family Clinic. We have Dr. Olufumilola Esho, who is currently on the modular MBA program. She is the Deputy Director of Lagos State Health Service Commission. We have, of course, our host, Dr. Dolapo, as we call him, who was the one on our full-time MBA program, and he's currently the API Product Manager for Commerce School. And we have Dr. Uzodinma Ume, who also was a full-time MBA student and is Chief Medical Director for Zuri Health. So in conclusion, what we're saying basically is that business education can play a critical role in overcoming the challenges facing healthcare professionals in Nigeria and Africa. We're really grateful to have our guest speaker, Dr. Tosi Majekudumi, who is the Medical Director of URK, who has gone literally from the Wardroom to the Boardroom. So he's going to be sharing his own experience with us. By providing healthcare professionals with a well-rounded education that combines business management skills, core technical skills, and experience, business education can help healthcare professionals tackle the challenges of the industry more effectively and drive growth and development in the healthcare sector. The point here is that, like any sector in Nigeria or Africa, you're faced with the same challenges. You're faced with people challenges. You're faced with issues of dealing with finance, the issues of managing your patients every day. But we now know that having a background in your sciences, your technology, whatever degree, it has its advantages. But when it comes to business, there are certain things that you need to know. So generally, the point is that we all need to make an investment in acquiring business education. And so equipping ourselves with a business degree can help us improve our chances from moving from the boardroom to the boardroom. All right. Thank you very much. Over to you, Dalako.
Thank you very much, Chinedum. Thank you very much. That was a wonderful, wonderful introduction. And probably to put it, to summarize the introduction in medical parlance, there's the operations aspect, there's a strategic, there's a leadership, there's a management aspect of health. If a patient is comatose, we know as health professionals to check airway, breathing, and circulation. If a business, however, is not responding, do we know the airway to check? Do we know the breathing to check? Do we know the circulation to check? And I'm sure that's what we're going to be delving into today. So I'll be bringing up the keynote speaker, Dr. Tosin Majakudima. And just to set perspective, he left Nigeria for the United Kingdom at the age of 14 after completing his secondary school education at Baptist Boy High School, Abeokuta. In 1990, at the age of 16, he was successfully given admission to the University of London, King's College, for his undergraduate degree in biotechnology, which obtained in 1993. Proceeded to register for a research project in biochemistry at University of Southampton, and that led to the conferment of a degree of Doctor of Philosophy in 1997. He enrolled in St. George's Hospital Medical School, London, and completed his undergraduate degree in medicine and surgery in 2002. Completed his medical and surgical internship in London and Basingstoke, respectively, before returning to London to complete his residency in internal medicine in 2006. Dr. Majakudumi was successful in obtaining a position in cardiology residency in the West Midlands in 2007, completed 2 years of basic cardiology training. 2009, achieved the milestone of securing one of 5 nationally recognized training positions in adult congenital heart disease in London. He has an adult congenital fellowship training, which was conducted at the world-renowned Royal Brompton Hospital, Guy's and St. Thomas Hospital, as well as Great Ormond Street Hospital, before moving to Toronto General Hospital in 2012, where he pursued an interventional and structural adult congenital heart disease fellowship, which he successfully completed in 2013. He's fully trained in all forms of minimally invasive structural and valvular heart disease interventions, diagnosis and treatment of pulmonary hypertension, and clinical assessment and treatment of pregnant women with cardiac diseases. He relocated to Nigeria in 2014, and since 2016, he has been the interventional cardiologist and the medical director of Eurocare Multi-Specialist Hospital. Ladies and gentlemen, I know you're muted. You might not be able to clap and appreciate and show your appreciation, but please welcome with me Dr. Tosin Majakudumi for the keynote speech. Okay, thank you. I see the reactions. I see that everyone is excited. And Dr. Tosin will be sharing shortly. Now, just shortly before we started the session, he had mentioned that he possibly has a patient who might need some attention. Now, if you remember, I read that he's an interventional cardiologist, right? So maybe, just maybe, he had to do that in the line of duty. But I'm sure he's going to come up on very shortly. At this point, I'm actually strongly suspecting that maybe he really had to go to attend to that patient. All right, so maybe what we'll just do now is we'll move to the panel session because we have a panelist here. We don't want to keep everyone waiting for too long. So we'll have the panel session, and then maybe we'll then circle back to having the keynote by Dr. Tosin. So our panel session I'll be speaking to 3 doctors in the session this evening. First off is Chinedum already introduced the 3 of them. So I'll just briefly also just go ahead and give a little backdrop on everyone who is going to be having the panel session. So Dr. Olufunmilola Esho, she's a seasoned and passionate administrator and public health physician, currently deputy director with the Lagos State Health Service Commission and enrolled in the modular executive MBA program of LBS. Dr. Esho, you're welcome to the panel session.
Thank you, Dolapo. It's a pleasure.
Thank you. Yes, I also have Dr. Olayinka Olujolu serving as the Chief Operating Officer and Lead Panel Physician at Q Life Family Clinic. And also he serves as a board member on Teen Guide Africa, as well as Dr. Funmi Alakija Foundation. Dr. Olujolu, you're welcome, sir.
Yeah, thank you, Dolapo. Good evening, everybody.
Yeah, thank you. And finally, also on the panel, Dr. Uzo, who is the Chief Medical Officer and Chief of Staff at Zuri Health, which is a health tech company that started in Nairobi, Kenya, and now present in 8 African countries. Also a former full-time MBA student of Lagos Business School. You're welcome, Dr.
So much, Dolapo. Thank you. It's a pleasure to be here.
Awesome. So we can kick off the discussions. And the very first question is, I'll just throw that to the three of you, is why is it important? And we've heard Chinedu's earlier introduction. You are in it practically. We have a lot of people here who probably don't see the need that to learn the leadership aspect of leading a health business or being in a health business. So why do you think it's important for healthcare leaders to have a strong foundation in business skills, and how does that impact the delivery of quality care? I think I'll start with you, Dr. Esho. Ladies first.
Yeah, good evening, everyone. So thank you, Dolapo, again. So healthcare is a business, and we need to dispel the myth that it's just a social service, because when we finished medical school, many of us felt healthcare was just a social service. With time, we understood better that the business aspect of healthcare is what sustains the healthcare industry in its entirety. So let's look at it this way. Who is a healthcare leader, and what's the role of a healthcare leader? A healthcare leader and medical director has 3 main roles. He manages human, he manages financial, and manages material resources. So in the management of human resources, what does he need? Human resource management. If he's managing finances, he will need to understand financial management. What are financial statements? What's statement of financial position, income statements? Does he know where his expenditures are going to? Does he understand how to reduce expenditure without compromising on quality? Then we go into material resources. He needs to understand operations management. How are the processes in the hospital? How can we reduce unnecessary processes or steps? How can we increase efficiency and effectiveness in the healthcare industry? So he needs to understand operations strategy, strategic planning, like our hospitals, our general hospitals now have. We have strategic plans that we develop annually that guides the activities of the hospitals for the year. So how does it affect the quality of care? So as I said, it's a business. And why are people in business? We're in business to make profits, to make money. And when we make money, we're able to innovate. We're able to embrace the use of technology. Look at the public health sector where I come from. Our major challenge is waiting time, long waiting times. We try to reduce waiting times. Okay, we could do process maps, we can shorten some steps, but then we could embrace electronic medical records. It doesn't come cheap. So if we're not profitable or we're solely dependent on the government, we're unable to employ that use of technology. The issue of missing files, delays at different departments is a thing of the past. There are things like queue management system. So we now understand that as leaders, you need to look at the data. What does the data tell you? Do you know whether your patients are satisfied? So your patient satisfaction survey are one of those things you need to look at. You need to understand what quality means to the patients. What it means to you might not be the same thing it means to the patients. You look at your patients' attendances. Is it increasing? Are you retaining your patients? Are they coming back? are more people interested in coming to your facility, that signifies some quality of care. Those are some things that you will know that that gives an indicator that you're doing the right thing. You're on the right path to delivering quality care. So I will stop here, let other people share some insights as well, because I could go on.
Oh yeah. Thank you very much. And I mean, you touched on how that it's key to be able to balance those three resources: the human aspect, the financial aspect, and also the material resources. And also, I like that you mentioned the EMR, right? So I'll go to Dr. Oluwojolu next. I know that QLife has implemented and is doing great with EMR. So tell us about your own experience in terms of balancing this business knowledge that is important within the healthcare space.
All right, thank you, Dolapo. I think Dr. Esho said healthcare is business, but I know there's a saying where it says healing is an art, medicine is a profession, but healthcare is business. That's actually the full saying. And it's important that we keep that in mind, And like you said, for instance, in my clinic, we do have an EMR. And for instance, just the implementation of that EMR and being able to change how that EMR works and bringing a lot more innovation into it has really, really helped us. And moving away from paper-based records to going into an electronic system and even trying to help it make it better has a lot of impact, not just on us as an organization, but also on the patients, because eventually we are delivering good health care. Because you see, in the end, what the patients want is health. You may be looking at it from a different aspect, but you need to see health as a product that the patients or the clients require, and you need to come up with the right methods, strategies to ensure that you're dealing with that. Something that Dr. Esho did not mention, and I think it's important that I bring that in, which is one of the core things that we learn in business school, is, for instance, the ability to lead large, diverse teams. And, sometimes as doctors, we think that healthcare is only all about us. But then you recognize that in the healthcare space, depending on which organization you're leading, you would have to interface with so many other professionals or people across different teams, sometimes across different cultures, and even now across different generational grades. Now you're dealing with, I don't know, the number of people that are on the Zoom call, for instance, but probably we're from different generations. And you need to learn how to deal with people. You need to learn how human behavior in organizations and how to motivate people and get the best out of your team. And really, really, these are skills that you need to learn and pick up in business school.
Absolutely. Thank you very much for that robust response. I'll move on to Dr. Uzo now. Dr. Oluwojolu had mentioned healthcare being a product. I'm not sure if I'm quoting that correctly, but tell us about this product aspect of it and how the business skills come to play in it.
Okay, thanks, Dolapo. So, I am firmly of the belief that healthcare is a fundamental human right, in as much as I see it more like a commodity, right? So again, in as much as the industry is changing and a lot of things are happening and it's not in an isolated world, as it were, the customers are also changing. How they want to receive healthcare is also changing. The channels with which they want to receive care is changing. In the past, you had a lot of times where people, back in medical school, where people thought that the doctor was king and whatever he said was rule of law and all that. But now patients are more informed with the age of the internet. People want to access care on their phones. People want to access care. People now want the doctors to come to their houses, right? People want them to come to the offices. It's really the product or the ways health care delivery is going is really dramatically changing. And I see this, obviously changing even more and more and getting better over time. In as much as you have the traditional systems which will keep trying to provide and fill this gap, you also have now a lot more digital solutions. You have health tech companies which have sprung up, not just because of COVID, but also because of the reality that for us to be able to scale and provide healthcare service, we need to find other means, other alternatives. If you thought that, the healthcare hasn't really changed and you don't need all these business skills, as it were, to basically run a healthcare outfit, you would see yourself now dealing with personnel issues, right? With doctors emigrating to other countries. As a medical director of a large healthcare institution, you have to hire, you have to deal with hiring, you have to deal with workforce incentives, you have to deal with training, you have to deal with also building capacity within other teams. You also have to deal with patient experience. These were not concepts that some of us may have learned back in medical school, or if we did learn about them, they were more or less hush-hushed, but now they're becoming things on the front burner. Patients are now able to rate hospitals and decide, the hospitals that they go to based on what they read in the press, what they read on social media. Hospitals now have to, or healthcare institutions, not just hospitals, have to have digital presence and manage the sort of public perception of their image online. And these are all sort of things that are definitely impacting healthcare from a holistic perspective.
Absolutely. Thank you very much. The clients, the patient is becoming more enlightened, and it's important that the healthcare delivery system is also being able to align with that. Awesome. Thank you very much. The next layer I want to take you to now. We have more than 200 people right now on this call. So someone just heard that and is like, hey, all I've learned so far is the operational clinical aspect, and that's what I know. That's what I'm great at. How do I then abandon the stethoscope? Do I abandon everything I've learned and decide to start focusing on these business skills, on these management skills? So back to you, Dr. Esho. How, as a health professional, do I get to balance this? And I mean, how has that worked for you from your own personal experience?
Thank you, Dolapo. So I would say you won't abandon your clinical expertise, because as a healthcare leader, your clinical expertise has a lot to play. There's a lot of role in it. You have to take clinical decisions. They're taking decisions that impact on clinical outcomes. So you need to have a good understanding. That's why just not anybody could just lead a healthcare institution. So the truth is that it's a balance. As I said, I could be an expert in my clinical field, but I need to acquire this administrative, management skills, business skills, and combine both. So for many people, it seems difficult, because I remember before I went into the MBA, I'd been thinking about it for about 7 years, 8 years. Every time I ask a colleague, they'll say, you don't need it. It's a waste of time. It's a waste of money, because we did not see the value. You put money in things you see value in. So we're not taught the value of business skills. We didn't understand. It's no wonder we look back and wondered why there were so many failed hospitals, when in many leaders of hospitals, and they were working at suboptimal capacity. They were experts in their field, but they couldn't deliver. And at some point I told myself, have we equipped them with the requisite skills to deliver on this mandate? Because I'm in public health care. So I've been in administration for about 12 years. So I've seen so many medical directors, and each time there's a discussion, I wonder that we haven't equipped these people. Being a cardiologist, being a nephrologist does not make you an administrator. You need to learn the skills. It's not about banning your cardiology or nephrology. You can see Dr. Tosin, he's doing excellently well. Why would I go to a Eurocare? He's combining both, the business skills, the medical skills. So he can converse with his patients, he can also converse with the leaders in the industry, the leaders of the hospital, the healthcare management team. So it's about striking a balance with understanding. You know, as a medical professional, you sit in a boardroom, the finance people are going on with their jargons. You don't understand what they're talking about. Whatever they advise you, you have to take it. But when you understand finance, you can make an input. That means nobody can scam you. You understand what's going on. You understand human resource management. You know how to communicate. Why are we always in the public? Oh, poor communication skills. What they talk about doctors and healthcare professionals. We don't document. We don't communicate appropriately. Why is there litigation? So we need to learn these skills. We're taught a bit of it in medical school. But truly, I feel the medical curriculum should change. There should be more focus and emphasis on business skills, managing a healthcare institution, leadership, and management. So for many of us, we had to learn the hard way on our own, decided that I want to be a different leader. As you said, a lot of people have jackpot. Some of us have not jackpot because we want to develop the system in Nigeria. We've stayed and we are equipping ourselves for that next position. Thank you.
Absolutely, absolutely. Thank you. Chinedu had mentioned 24,000 healthcare professionals in the country, $95 million industry. I mean, we have a thin slice of that number here, and I'm sure that we're able to impact them. Dr. Olowojolu, I'd also like you to answer that question. And I also just want you to tell us a little bit about the operational. Operation is very important, and as Dr. Esho has mentioned, how that sometimes they are great surgeons who are terrible at operations, and of course, wait time is a major complaint that the average client, the average patient out there is going to make about hospital. How has business knowledge helped operations? I mean, you are the chief operating officer of QLife. So just tell us a little bit about that, and also about balancing clinical and strategic knowledge.
All right, thank you again. I think that, like you said, both you and Dr. Shaw, the most well-intentioned doctor can turn out to be a poor administrator through no fault of his. Sometimes we think that business skills are innate, but the truth is that experts have not innate. It has to be learned. It's just that.
Okay, I think we have some slight internet challenges, part of the infrastructure conversation that we're also having here. Okay, so hopefully we'll get Dr. Olowojolu back very shortly. I can just move on to Dr. Uzo then. So to just give us you can just give us your take, balancing clinical and business skills as a health professional.
Okay, thanks, Dolapo. I think it's very key that as a clinician, as a clinical professional, you don't necessarily need to abandon, one's own clinical practice or clinical whatever practice to take up business skills. It starts from actually recognizing that I need to learn these things. I need to be well equipped to run an outfit. I need to go find the right place, the right school, the right set of skills that I need, and then go for it. I mean, it has to be intentional as a clinical professional. Very early on, it was a decision I had to take because, one of the things that was glaring was, the general lack of leadership in many of the things that are going on. So while studying and seeing how things are run, you realize that there's a whole lot of wastages, a whole lot of inefficiency in the system, and there wasn't just so many people to look up to. And then you decide to say, okay, do I want to just be an average Joe out there, or do I want to go and equip myself to be able to fill in these gaps? And it all starts from little things like quality, putting in place the right quality steps, from the smallest primary healthcare facility, having quality controls, SOPs, guidelines, things that people can follow. And you find out that, these things these are actually the baby steps of management. How does a restaurant ensure that this meal is the same thing each and every time it's prepared? This burger comes out the same way. It's SOPs, standards. So you find out that these are some of the things that are lacking, things like corporate governance, setting up things the right way. These are things that sounded Greek to the average clinician, and you can't just think that you can either wait and learn by making mistakes, which can be costly sometimes, or you actually go and equip yourself with those skills?
Absolutely. It's important to just to ensure that you're getting the skills so that you don't get to the point where, like, hey, clinical is great, but then operation not so good. Dr. Lojoda, I'll allow you finish the thoughts that you had before we round off on this panel session and then move on to the keynote speech, please.
Okay, sorry, I got bumped out. But what was the last thing you heard me say?
Anyway, I think you can just pick it up from balancing clinical and business skills. And I think I asked you about the operations aspect. I think you were just getting started as at the time we lost you then.
Okay. All right. Yeah. So maybe I'll just talk about that briefly, because you see, for me, it's not that I've moved fully away from clinical practice and I only just do administrative work in the clinic. I still do a bit of clinical work. And for me, what has helped is being able to I'm trying to acquire business skills training at the same time while working. And so that has really helped me. And so I chose a course that would allow me work and study at the same time. Yeah, it is tough. It demands a lot of sacrifice and diligence, but that is what I've been able to do. And in fact, all through my career, there was nowhere when I stopped practicing to go and acquire education. No, I always did it alongside different courses that I've taken, yes, side by side. And that's what I have done.
Oh, great. Thank you very much for that. I see in the chat requests for questions. You can please drop your questions into the chat. We'll be able to take it. Take a question from there. I see there is one question from, I hope I'm pronouncing this right, Ijeweme Odiawa. Do we all need to have business skills? I think I'll allow Dr. Esho take this briefly. The question is, do we all need? I think many of our colleagues are better served focusing on their clinical knowledge, whilst probably some are better focused on business skills. So, Dr. Esho, what do you think, please?
Well, I think when I first read the question, I was wondering, but she ended it well. So we all need business skills in everything we do. You need business skills because, as I said, business skill encompasses a lot, as someone mentioned earlier, human resource management. It's not just about leading a healthcare institution. Everybody manages human resources. How do you attract the right people, the right skills mix? How do I retain them, prevent them from jackpying? How do I motivate them? How do they perform at optimal capacity? Any business, any organization needs this. So wherever you find yourself, you need this skill. So we're talking about financial management. We used to think it's only the accountants that need it. Oh no, not only the accountants. You need to understand your financial position. You should know whether my organization has a good financial health. It should be a prerequisite skill. Like in my organization now, I'll say in Lagos State, we use the Health Sector Reform Act of 2006. That's 17-year-old law. It says to become a medical director, you should be 10 years post-qualification. Secondly, you should have a postgraduate degree in any field of medicine. But in brackets, it says a postgraduate degree in business administration is another advantage. That's as far back as 2006. Someone had that vision. If that law has been updated, it's been updated now, obviously it will now become mandatory. Before you even get to that point, you already know, because these things guide how we behave and what actions we take. So obviously, if 2006, they saw the importance of that, it helps me even in the running of my home. Operations management, how do I balance my resources? How do I use everything effectively? So it's not only about leading a healthcare institution, it's about your life. So business skills help you it's a lifelong skill. I don't regret it. I only regret doing it so late in the time. I should have done it so many years ago and not listening to the naysayers that it's not important, it costs money. But I found a school that allowed me to work because I'm quite busy at work and study at the same time without robbing any of them, because I like to be ethical. I don't use my work time to study. So it's a balance. Maybe that extra time I'll use going to parties or making noise with friends, I use it to do assignments. I'm more focused, I'm happier. My quality of life, my outcome, the way I feel about things generally. So it helps you in your entirety. So I believe as soon as you can, please get a business skill. Many schools offer payments instrumentally. The courses are very useful. They are very interesting. You'll be wondering, what am I doing with this course? By the time you finish, you appreciate it and it transforms you. So it's that transformation I have enjoyed. So I would advise anybody, don't think twice, just go for it.
Awesome, awesome. Thank you very much, Dr. Esho. You've heard her advice there. Get it done as soon as possible. Get that business, get a business, that extra business knowledge as soon as you can, so that because you're going to apply it across board. Thank you very much to our panelists. Thank you, Dr. Esho. Thank you, Dr. Uzo. Thank you, Dr. Olojolu, for your time. Now we're going to go back to Dr. Tosin Majakudumi to deliver us the keynote speech. Thank you very much once again, my panelists. Dr. Tosin.
Good evening, everyone.
Good evening, sir.
Good evening. I'm sorry I'm late. I had a slight medical emergency, of course, it would happen on the one day that I'm supposed to be delivering a keynote address to all you guys. Dr. Esho knows that I'm busy clinically here, as Dr. Olojolu. There are a number of colleagues in the audience, so I thank you for your indulgence. So I'm going to give a brief talk on just a quick outline on the changing landscape of the healthcare industry. I'm just going to give a bit of a historical perspective as what's been happening in healthcare in general. I'm going to talk about two other environments that we in Nigeria use to look at healthcare, the UK and the US. Then I'm going to talk about Nigeria more specifically and exactly what is happening currently. So just to talk about healthcare in general, obviously, scientific progress really reached its peak in the 19th century, and coming into the 20th century with the advent of antibiotics, that's when really things took off. There was no organization in terms of proper hospitals, because of course we didn't know what we were doing. And so prior to 1948, just with the very crude form of healthcare that existed, it was not organized. Patients paid out of pockets to people who trained as health practitioners. Large numbers of people did not have access to any form of healthcare. They had to have subpar healthcare provision. There was no regulation. There was a large variability in the quality of care. But as progress continued and technology improved and the drugs improved, and there was a clamoring for a universal right to access to healthcare, when it was now obvious how important it became important to now get this thing organized and regulated. As I mentioned, before the birth of the NHS, citizens got the healthcare in many different ways, lots of different organizations, providing lots of overlapping services. In spite of that, there were still a lot of gaps in provision, and a lot of hardship for a lot of people. For the middle class and upper class people, it was relatively easy to get access to healthcare because they could pay the private fees and settle, their fees after the bills after any consultation. But for the vast majority of people, this was difficult. I'm sure this situation pre-1948 in the UK sounds a little bit familiar to what we are seeing in Nigeria in 2020. So 1948 was a game changer when the Aneurin Bevan set up the National Health Service. And what he basically did was co-opt all the healthcare practitioners under the government. Basically, it was a buyout. Everything was organized under the government, all primary care services, dentistry, ophthalmology, everything was put under the National Healthcare Service. As you can imagine, something that was touted as free at the point of delivery. In the first 10 weeks, 30 million people were treated. 30 million. People were rushing to the dentist, people that would never normally go and see a dentist, people that would never go and get their eyes checked and needed spectacles. All of a sudden, they were all rushing because it was all quote unquote free to be able to access service. And then the NHS, of course, has become very successful in that I believe it's still the largest employer in the world. Care is provided free to the point of delivery to all. who are eligible to it. Obviously, since 1948, there's been a complete revolution in technology and the kinds of treatments that are provided, and multiple reforms have been undertaken in an attempt to try and make the provision of the care more relevant and also more efficient. Part of that reform has included getting dentistry and optical care has pretty much been moved wholesale to the private sector, with very little being done under the government auspices. There are ongoing discussions with respect to cost, with respect to the variety of treatments being provided, with respect to regulation of the treatments provided, and how to ensure that quality is maintained. Private healthcare has always existed since the inception of the NHS. About 17 to 20% of all healthcare in the UK is provided through the private sector, largely insurance driven, but some also out of pocket. And the people that choose to do this usually opt out of NHS care, mainly for convenience, maybe more rapid access to specialized care. Those who are seeking more individualized care are also the kind of people mostly that go for private healthcare. So we can see that, let's go back. We can see that there are a variety of ways. So I've talked about the UK experience and the fact that they have a single payer, which is free government provided healthcare paid through income tax revenue, and every citizen has the same access to government services. There are other different models where, for example, in Germany, you have a government insurance based system, but the doctors and hospitals are all private, and they are the ones who provide the services. In Canada, they have a national health insurance system where every citizen pays a national health insurance premium, and it's publicly funded, but it's privately delivered through private clinics as well as private hospitals. Now, I mean, one of the reasons we're all gathering today is to talk about the business aspect of healthcare. And I think it's fair to say that, the awareness of the business aspect of healthcare really got generated from the US, where healthcare provision was mainly provided through private providers and was funded through private insurance. There are government aspects to the insurance for Medicare, for those who are unable to, for the elderly, and Medicaid for those who are unable to afford any form of healthcare delivery. But the model is really that care is delivered privately through private clinics, private hospitals, through insurance. And through this, many of these insurance companies and many of these private hospitals have actually been seen as generating a lot of revenue, and as part of that, a lot of profit. And this has now spurred the interest, or this has garnered the interest of investors who have seen that there are returns to be made by investing in hospitals, investing in insurance companies, and seeing that they can get some returns from this. And so that is where the business of medicine really started developing. The US, as part of that, has the highest expenditure of healthcare in the world, both by absolute revenue and also by proportion of GDP. You can see on these two slides that the US spends the most on healthcare compared to their GDP. On the panel on the left, you can see that they spend about almost 16 to 18% of their GDP on healthcare. Other similar sized economies or other similar economies, France, Japan, Germany, Sweden, and others, spend much less. Switzerland is relatively high at 12%, but the OECD average is really around about 9 to 10%. And you can see in terms of dollar revenues that the US spends about $12,000 per capita in healthcare. That was in 2021, with Germany spending $7,300, the UK spending $5,300. Just as a point of comparison, Nigeria spends about $300 per capita per person on healthcare in terms of government expenditures. So we can see that if we have a desire to achieve the same levels of outcomes as they have in the US, in the UK, and Germany, we will need to increase the proportion of what we spend on healthcare quite significantly to be able to desire the same levels of outcomes. The advantages of this significant healthcare spending has been really that they have had very excellent outcomes, mostly in respect to specialist care. And the reasons for this are not difficult because specialist care is where the margins are. And so that is what drives where the investments tend to go. And that's where you see the best outcomes because it is to the advantage of most institutions to invest where the margins are going to innovate in cardiovascular care, oncology care, to be at the forefront of technology, where they can charge more for perceived or actual benefits in treatment and outcomes, and then they can obviously sell those as benefits to their customers. This has led to a lot of innovation in high technology and also in approaches to treatment. So all that expenditure has had its advantages, but there have been some disadvantages as well. There are spiraling administrative costs. So if you look at the US, it is estimated that about 8% of administrative costs of the healthcare expenditure is just administration. In most other similar sized countries, 1 to 3% is the norm, whereas for the US, it's 8%. Look at the cost of pharmaceuticals in the US. This again drives the very high expenditure they have on healthcare, with about $1,400 per capita in the US for drugs, whereas it's only about $500 to $900 in other countries. And then, of course, more controversially, the salaries that are paid to their healthcare practitioners in the US is also quite in excess of what is applicable in other countries as well. All these factors tend to factor into making the costs as high as they are. But unfortunately, when we look at the outcomes that they're getting on a population basis, the outcomes do not really match up with the amount of expenditure that they're getting. So you can see that the US ranks 34th in life expectancy at birth compared to other countries. Japan is the highest with a life expectancy of 84. These are 2014 figures. Coming more recently, the average overall life expectancy in the US has been dropping, even stripping out the effect of the COVID pandemic to about 73 years on average, where it's much higher in other OECD countries. On the panel on the right, you can see that the US is certainly an outlier in terms of expenditure and life expectancy, as you can see. So they're not really getting, on a population basis, the desired outcomes they want for all that expenditure in healthcare. And we can see that some of that expenditure is ending up in the profits of the healthcare companies and the pharmaceuticals. These are 2020 figures looking at some of the largest healthcare providers in the US being extremely profitable. And the same is seen here for 2021, $4.9 billion for the United Health Group and others, all of them making major profits, which is another place where a lot of the healthcare expenditure is going. Now, of course, as business leaders, we all want to make profits, but we want to also be sure that we are offering good outcomes for the value that we are creating. And you can see that if we project going into the future, we can see that there is going to be ongoing increase. It is projected there's going to be ongoing increases in healthcare expenditure, and it's going to outpace GDP, at least certainly in the US. Now, that clearly is not sustainable, and they're going to need to adjust their models of how they fund healthcare and how it's provided in order to deal with this gap, this fiscal gap that exists between expenditure and GDP. So coming more specifically to the Nigerian experience, Nigeria is a very large country, 200 million people, and as we have been developing, we're seeing a much larger increase in proportion in non-communicable diseases. So 2021 figures show that 29% of all deaths were due to non-communicable diseases such as hypertension, diabetes, heart disease, stroke, kidney disease, etc., etc. And this is increasing. We no longer cholera, malaria, and things. The largest aspects to the mortality that we see in our healthcare space. I tell a lot of my colleagues abroad that in my practice, certainly I know I work in affluent Victoria Island, we see a lot of, all I see is diabetes, hypertension, heart disease, and complex disease, just as you would see if you were in a suburb in Los Angeles or New York or in London. That's exactly what we see working in Victoria Island. Absolutely no difference. So we need to also have the infrastructure to match the disease burden that we are seeing. And we can see that the patients are making some decisions. So it is popularly quoted that $1 billion is spent by patients seeking care out of the country every year because they feel that they can't get that kind of care in Nigeria, and so they're seeking that care outside of the country. It is noteworthy that almost 90% of our population don't have access to any form of health insurance. Just to put some indices, which I'm sure everybody listening is aware of, we're very low on the rank of infant mortality. Life expectancy is 52 years. Even in the US, where it's dropping, they're at 73 years. In Japan, it's 84 years. The number of people who have access to quality healthcare is very, very low. And if we look at the way in which money is spent on healthcare in Nigeria, you can see that in African countries, on the panel on the left, 37% of all healthcare expenditure is out of pocket, with some contribution coming from insurance companies and some government expenditure. You can see that in the UK, the vast majority of it is all government funding, with about 17% being private. And in the US, 77 or 72% is healthcare, and then just only 11% is out of pocket. So you can see that different countries have different models as to how they structure their healthcare. And I think in Nigeria, we will come to our own decisions about the most efficient way that works for us in order to do it. And I trained in the UK, and I know a lot of people believe that the UK has the best model. But even though this has been marketed to Americans on a number of occasions very, very strongly, they continually reject it because in their society and in their culture, the system of health insurance appears to suit them better. I think in Nigeria, we will need to also think about what system suits us better for our own particular culture, our society, the way our society is set up, and in what people exactly want. As I said, about 70% of healthcare funding in Nigeria is expenditure in Nigeria is out of pocket compared to other countries. And then this is a very busy slide, but I just draw you to the attention of the red circled aspect, where in a poll in November 2021, 43% of Nigerians said that they were not willing to pay for monthly or yearly access for health insurance to allow them to access care when ill. And a lot of work is going to be done to either try to increase that proportion or structure our services to cater to the fact that maybe insurance is not going to be the largest driver of healthcare expenditure in our situation, and we will need to think about more innovative ways of giving these people healthcare without having access to insurance. So traditionally, the problems that we have had in Nigeria specifically, in terms of people being able to access healthcare, certainly those who can afford it, have been perceived or actual infrastructural deficits, a lack of equipment, unreliable availability of services, particularly in the public sector due to strikes, which were much worse in the past. Manpower shortages. We've been talking about the jackpot phenomenon, both in nursing and in medical, and also other allied services. Just yesterday, one of my radiographers handed in his notice. He's going to the UK, and I think about 6 or 7 of our radiographers in the last year have jackpot to the UK as well. And also, finally, a lack of trust due to poor outcomes in medical services. I'm sure there isn't a single member of the audience who doesn't know someone who has been to hospital who has had a poor outcome in a healthcare facility in Nigeria, whether public or private, due to perceived or actual poor medically negligent care. So just looking at this is a slide just cumulatively looking at the business aspect of healthcare expenditure. And between 2011 and 2021, about $11 billion was estimated to have been spent outside of the country on healthcare, on accessing healthcare. And you can see there the proportion of our national budget that is being spent from 5.5% to between 5 to 6%, whereas what is actually spent on our national, as a proportion of our national budget, is closer to something like I think it's about 2 or 3% on the last budget. So, what areas are people going out of the country to get care? Where are the perceived gaps where services can be provided? The primary reasons why people travel out of the country are oncology, interventional cardiology, neurosurgery, orthopedic surgery, plastic surgery, and ophthalmology. Again, you can see that these are all areas that are very procedure-based, which require highly technical equipment. There are areas which traditionally, when you look at the UK and the US, are high-margin areas for the provision of services, and which are profit drivers for many hospitals. and this is what have been driving Nigerians to go out of the country. Prior to now, traditionally, the public hospitals have not had the level of investment required to be able to provide these kinds of services. And so they've largely been taken up into the private sector. And so this has really provided an opportunity. So gaps like that provide opportunities for the private sector for investment. So things that people commonly tout as being attractive for Nigeria for in terms of healthcare investment, the large and growing population, a hoped for economic recovery, a rising demand for specialist services, increase in the rate of non-communicable diseases, which I talked about earlier, which require, highly technical diagnostic equipment, CT scans, MRIs, ultrasounds, cath labs, hybrid cath labs are coming, and all these provide opportunities for further investment, because it is clear, we've already shown that people are willing to spend the money at a not insignificant rate to access these services. So just being able to provide services for them provides a good business opportunity for a savvy investor. The issue of now getting these services to the vast majority of the population, that will fall to the remit of the government to either do it themselves or to come up with the innovative incentives to get the private sector to step into that space. So there's a lot of investment in the private healthcare space to try to bridge the gaps in those areas I mentioned earlier. I work at Uracare Multi-Specialist Hospital, where we have made some investments to try to bridge those gaps, but there are other facilities, Evercare, Lakeshore, Marcel Ruth, First Cardiology, Lagoon, Pilon, and others are all making investments to try to attract more and more patients to spend their money in Nigeria and access care in Nigeria. There are many upcoming projects. There's the Lagos American Specialist Hospital, Ambulatory Surgical Center of Lagos. All these centers are coming up. It's interesting to know that apart from the Duchess Hospital, all these facilities that I mentioned are based on the island in Lagos, which also has its own problems associated with it, because it means that other areas are not being served in the same manner. So the optimistic view that I see as our landscape changes in the healthcare sector is going to be the increasing leveraging of technology to bridge the divide. I mean, I said in my slide between rural and urban areas, but we can probably start bridging the divide between the island and the mainland in Lagos to start with, and then we can look at other areas, and leveraging technology to do this will be important. I think the private sector involvement in training of medical personnel, both medical and non-medical, is going to be very important. The number of trainees that are being generated through the traditional output areas is not sufficient, and increasingly not of the right standard and quality to be able to provide the world-class healthcare that we're all desired to provide to the population. The increasing competition between all these facilities, all within a few square kilometers of each other, is going to drive innovation and will help reduce costs. Just thinking that you can work with lots of other facilities, because patients have choices now. They can go to lots of different places to get their care. You are going to have something that differentiates you from other facilities in the way you provide your care, and that's not going to be in the fact that you have a CT scanner or an MRI scanner, but it's going to be in the patient experience. What is the experience of the patients when they come to your facility? We talked about waiting times. I heard that on the panel discussion earlier. Waiting times will be an issue. Anybody that can innovatively reduce waiting times, speed up access to care, have a better communication between the healthcare providers and the patients, these are the people whose businesses are likely to be more successful as we move forward in the future. Other aspects of the healthcare business that we need to look at is manufacturing. Consumables are a huge aspect of what we do as hospitals, and having to import most of our consumables provides is detrimental in terms of cost, and also in terms of getting these in terms of inventory. Being able to manufacture these things locally will be of great help, and also with the foreign exchange obstacles that we're facing at the moment, reducing our reliance on that level of foreign exchange will also be helpful to people who run businesses. Opportunities are now arising, which we are seeing in terms of inbound medical tourism from the surrounding region, talking about Ghana, Ivory Coast, Senegal, Benin, Cameroon. We're increasingly getting patients from these areas coming to Lagos to access the specialist centers that now exist, both ourselves and also to other facilities on the island. And finally, increasing awareness and willingness of patients to pursue redress when they think they are getting suboptimal care in the form of medical, legal redress is going to help to raise the quality of care, will force people to stick to what they are good at and to make sure that they only do what they're licensed to do, and make sure that what they're providing is of the right quality. And we're seeing that increasingly. That I remember when I started in Lagos, you'd see a lot of patients being cared for in places where they had no business being cared for. But these days, increasingly, we get a lot of referrals where people are saying, this patient turned up in my facility. I'm not equipped to look after this patient. He needs to go elsewhere. And we're seeing that. And that is a good thing, because it means that the patients are being pushed to places that are more able to care for them. And that's the end of this keynote talk. I may have gone overboard in terms of time. I thank you for your kind attention, and I'm sure I hope there will be space to answer some questions. Thank you very much for your time.
Thank you very much, Dr. Tosin. That was a wonderful journey into history, what we currently have, and also looking into the optimistic future. Really appreciate you, sir. Thank you very much. I know that we do have some questions in the chat, and I can already sense that this is definitely not going to be the end of this type of conversations, especially in the case of healthcare professionals, business knowledge, business management. So of course we'll be taking cues to be able to organize a continuing discussion concerning this. Someone had asked in the chat about addressing the brain drain, and that came up in a lot of the discussions. So I'm sure, and also there's medical tourism, also something Dr. Tosin has touched in the keynotes. So possibly those are likely going to be conversations that we will be able to carry on going forward. I see, looking through the chat and just to see the questions that have been asked, I think there was a question, and I think this refers to the panel session talking about as healthcare managers. Do you believe healthcare workers are also your clients as an internal client, not just the patient? And of course, I think there has been some answer to that, in the sense that as a healthcare leader, you also need to be able to see your human resource and know how to appropriately manage them. I think Dr. Esho touched on that. There's also some other questions in the chat. If we're unable to answer a lot of all these questions, we'll definitely find a way to be able to reach out to everyone and be able to give more concise answers. Briefly, I'd want to go back to Dr. Olujulu and Dr. Uzodimma to just tell us about their own MBA experience, being medical doctors coming into an MBA program, your expectations going into it, very briefly, and how that experience has been for you. Let me go with Dr. Uzo first.
Okay, thanks, Dolapo. So, well, I would say I used to say then that medical school basically taught me the business of healthcare, and when I came onto the MBA, what LBS really taught me was how to understand the health of business. How do you diagnose business problems? Like you said at the beginning, what are the ABCs of business, right? I mean, it was a very intentional action of mine. Decided to go and do an MBA. After some years practicing as a clinician, I wanted to have the skill sets. I wanted to be able to have those conversations. I saw the world really changing very, very rapidly around me, witnessing, payments, transform from, queuing to ATMs to technology. And, here was I, we're still then taking case notes on paper. Healthcare seemed really, really stagnant. And, there were just so many issues in terms of how fundraising, investments, capital, all these things would seem sort of alien at that point in time. And I decided then to, look for a school or an institution that sort of had that prestige within Africa and, understood the Nigerian market a lot. And that was how LBS came about in my own research. And again, it was also close to home and allowed me to also continue my practice, or at least to stay in touch, even if I couldn't continue my practice so much during the full-time program. So while on the MBA, again, the networks were amazing. Again, I'm someone who loves to interact with lots of people, especially from across different fields. I like to see how we can leverage the innovation from payments, from fintech, from the e-commerce that was also growing at that point in time, and from different sectors. So I also got to mix up with a lot of people within my class who gave their own perspectives during the full-time program. And then also that really, really helped position me for what was to come after the MBA, being that, at that point in time, I was lucky there was an integrated healthcare institution that was coming up on board, and I was asked to join the founding team and, help put up structure, put up strategy for that. And it really gave me a whole lot of perspective about the healthcare problems in not just Nigeria, but Africa at large, because again, some of the issues also are the same in different countries. So the MBA experience was really, really interesting. It's within a short while, it's really exposed me to a lot of things. It really helped open my eyes up and allowed me to see healthcare from a different angle that I see it from now today.
All right. Thank you very much. Thank you very much, Dr. Ozo, for that journey from how you started the MBA and, of course, where you are right now. I'd like to go back to Dr. Tosin, if you're still there. One question concerning how I think this was from Precious Ugu. How is your firm helping local manufacturers, and what are the steps taken so far? Yes, so Precious Ugu asking this: how has your firm helped local manufacturers in terms of promoting? I believe this is in light of promoting the Naira, for example, right? Yeah. So please.
Absolutely. So, excellent questions. So one of the things that we have done now, Uracare is a relatively small hospital. We have 13 beds. Although we do quite a lot, but our size is our size. One of the things that we've done with other healthcare facilities around, and I think I listed some of them earlier, is all of us have come together and said, look, instead of everybody working in their own little silos, is there a way we can come together? And there are some consumables that are universal amongst all of us that all of us use. That can we come into a central purchasing agreement, and then that's the kind of volume. Those are the kind of volumes that now interest private providers, investors to say, well, okay, if there's going to be this amount of volume that I can be selling on a monthly or yearly basis, then it's worth me building a factory wherever and then shipping these things to these guys because I have customers that are definitely going to provide it. So we are trying to create a market for a lot of the consumables that we use that will incentivize the somebody to now, or any of the existing players, to be able to step in and provide solutions to provide for that market. And that's the best way capitalism works, is really around somebody having a need and then somebody using capitalist incentives and principles to answer that need or to solve that particular problem, and working together as healthcare because we all face this problem together. So we want to come together to solve it. And I think it does two things. It interests investors, but also allows healthcare facilities to partner with each other in sustainable ways. Yes, we're in competition in some respects, but it doesn't mean that because we compete with each other, we can't also collaborate in ways that best serve our own interests and also help to serve the patients as well.
Thank you very much for that, Dr. Tosin. I can see that your firm is very concerned about being able to have the local collaborations to ensure that there's sustainability, and that's awesome. And I think we have a testament in the Q&A from Bosola Yelowo, who says, I'm a doctor who's transitioned to healthcare management under Dr. Tosin's team, and very grateful to have you on the journey. That's a testament to your leadership, sir. And of course, I want everyone once more, I know we can't unmute ourselves. Can we please appreciate Dr. Tosin for taking the time to give us such a wonderful expose, wonderful journey through healthcare management outside the country and also within Nigeria, and also setting the backstage for an optimistic future. Thank you very much, sir. We really appreciate you.
Thank you.
Yes, sir. Yes, sir. You're welcome, sir. Though I have been slightly harassed in the chat by Dr. Esho, so I'm going to take her own success story, coming as a medical doctor into the MBA program. What has that been like? So after Dr. Esho, then I'll then take Dr. Wardroom. Please go ahead, ma'am.
Hi, Dolapo. Interesting. So really, for me, as I said, I was conflicted about doing an MBA. And what did I do? Because I like to have evidence before taking decisions. So I studied medical directors and healthcare leaders who excelled, who stood out in the public health sector where I was. And what was that factor that was common to all of them? I then realized all of them had an MBA. It was interesting to know because they were innovative, they were different. And at that point was my light bulb moment. I said, yes, I'm going to do this MBA. And I can say my life has changed. People wonder, how are you able to do so many things? How are you so ready to innovate? You are quick to problem solving, communication. In fact, we learned English, writing. You won't understand how much learning goes on an MBA, but the learning is wonderful, it's awesome. So really, don't do it because someone tells you to. Be convinced, have the evidence that it's the right path to go. So that's just what I wanted to share. And thank you very much, Dolapo. Very kind of you.
Thank you very much. Thank you very much, Dr. Esho. I can attest to the English aspect of the MBA. You'll be amazed how some things that you feel like you don't pay so much attention to, and you get in there and it's just a wonderful experience. Dr. Lojo, I'd like to take you before we move on to the next segment.
Okay, then thank you, Dolapo. So for me, it's slightly different from Dr. Uzodinma and Dr. Esho, because personally, I didn't want to do an MBA. So I'd done courses, leadership and management in health, in fact, healthcare management. And then my medical director calls me to his office and says, I think you should do an MBA. And in my head, I'm like, why? Himself and his wife were both alumni of Lagos Business School. And so he just said he thinks it was going to be beneficial to me. And well, I don't back down from a challenge, right? So I said, okay, no problem, I'll do it. And to be honest, what I've learned on the MBA, I'm miles apart from who I was when I started the program. And in fact, it was on the MBA I began to understand more and more of the things that I'd learned in the leadership and management program that I'd done, and even in the hospital and healthcare management program that I had just completed. And in fact, for me, it's also the fact that I was able to continue working. And so immediately I was implementing the things that I was learning. And so I'm going into every class thinking, how can this help my practice? And so I'm doing operations management and I'm thinking, how does it impact our operations in the clinic? And so it was in fact, every assignment we had, I tried to always make my practice the subject of the assignment or the project. And in fact, it was almost as if the company had an external consultant in me being able to do that. And apart from that is the vast network that the program afforded me. And part of the program involved doing a Pan-African EMBA module where we went to ISA in Barcelona and met students from Kenya, South Africa. And in fact, we're collaborating with some of those people now. In my class, for instance, I had someone who had even completed a PhD in accounting, and he was back on the MBA program. And so I had people from banking, oil and gas, telecoms, every sector you could think of, and rubbing minds and being able to learn and see how business works and all these concepts and being able to apply them. That really has been my own story, and it's something that I wouldn't trade for anything else.
Thank you very much for that. Thank you for also highlighting the international nature of the MBA program in LBS. I also even had the privilege of going to IESEC in Paris, France, where I completed my full-time MBA, and it was a wonderful experience across board. Now, I'm sure a lot of people currently in the audience are wondering, okay, the MBA. In fact, someone put in the chat, when is the next cohort starting? Is it online? So to answer these and many more questions, I'll be handing over now to the marketing team of the LBS MBA program. And I believe that's Mary. So she's going to tell you everything that you need to know and much more. Okay, then. So Busayo can then please go ahead and talk about the MBA program, please. Busayo, if you can go ahead and unmute.
Thank you. Good evening, everyone.
Right.
It's been an insightful webinar today, and I will just briefly go into what our MBA program is about. And first of all, I'll start with the benefits of our MBA and for the healthcare professionals, basically. So we're looking at the benefits of an MBA for our healthcare professionals. Our panelists have talked about a lot of these benefits, so I'll just breeze into. First off is it improves your business acumen. So when you get an MBA, you get a deeper understanding of business practices and principles that you can easily apply this knowledge into your healthcare operations management as well as your decision making. Also, it helps you for your career advancement. So your career advancement, it helps you to gain skills and knowledge necessary for your leadership roles that you can easily apply to your future roles in your industry, and also get greater responsibilities in the industry as well. Thirdly, the MBA helps you get expanded network. I think Dr. Olowo Jolu just mentioned that while he was talking about his success stories, about how much he met different participants from different industries. It helps you gain unique perspectives and opportunities even while networking with people. Exposure to innovation. So focus on innovation and entrepreneurship is also very important. It's one of the things that you get to benefit when you start an MBA. And guess what? You stay up to date with these issues that the latest trends in the healthcare industry, development in the healthcare industry. That's what this helps you to do with an MBA. Also, it helps you to enhance your problem-solving skills. Dr. Esho mentioned earlier that we have complex issues, and then it's easy for you to identify these issues and, of course, use your critical thinking and your problem-solving skills that you have gotten from the MBA in these issues after identifying them. The last one I'll be talking about is the increased credibility. Getting an MBA demonstrates a sort of commitment to continuous learning in your learning and professional development. And when you get that, it increases your credibility with your patients, your stakeholders, and even your potential employers. Now, it is not enough for you to know the benefits of an MBA. As an healthcare professional, it's also very important for us to know in choosing an MBA, we have to consider some factors. One of our panelists mentioned that while he was going to consider getting an MBA, he looked at some factors, and then Lagos Business School just was the right one for him. So it is important for us to look at some factors that we need to consider while choosing an MBA program. First is the faculty. So while you're looking at getting an MBA, look for an MBA program that has experienced faculty members that would expose you to the knowledge and experience that you need as an healthcare professional. The reputation of the business school is also very important because, of course, with a good reputation in the healthcare industry, it can help you enhance your career prospects in the industry. Networking opportunities. Look at the business school that, am I going to be exposed to so much participants and other industries as well? Because it will also help you as a professional to build relationship and expand your professional network after the MBA. And flexibility, major thing that I also got from our webinar today is that I understand the doctors have very tight schedules, and look at MBA programs that would occupy or that would help you manage your professional, that will help you balance your work and your study commitment, and also help you just have a work-life balance even at the end of the day. The location also is very important. All of these factors are factors that our panelists have one way or the other mentioned during their conversation to us. And then location is important. You want an MBA that is closer to you because of your work schedule so that you can easily breathe in and out. Flexibility, I was going to go back to flexibility. Flexibility also, MBA that you can that is open for an hybrid form of learning is also very important while you're looking at the flexibility factor. The cost is also an important factor. So I understand that the MBA program can be way above some of our budgets, but we can also get MBA program that aligns with your budget and make plans towards getting this MBA, explore scholarship opportunities or even funding opportunities. So your organizations can actually decide to sponsor you for an MBA, because in turn, it also helps the organization build your leadership pipeline and also helps you as an employee, your value proposition to the organization. So next, I'll be looking at these factors. So why are we looking at Lagos Business School MBA? Lagos Business School MBA is an excellent choice for the healthcare professional because of the experienced faculty members that we have. We have a team of faculty members that are experts in this industry, and then they provide valuable insights and perspective to participants. Our case study approach is also a great way that students can easily relate to scenarios that they have encountered in their industry. So the case study approach in teaching also allows the healthcare professional apply this knowledge in their field after the MBA. The networking opportunities, we got that also from the success stories that we heard of from our panelists. It cannot be overemphasized. It allows students get to expand their professional network with networking opportunities. The international exposure, we have partnership with schools outside Nigeria and in Africa. So you are exposed to meeting people, and it exposes you to global health systems as well. So you can also learn from these industries, from these countries, their health system, and while you're bringing it down here into Nigeria, developing our own healthcare system. Flexibility. Lagos Business School MBA is actually very flexible. It accommodates your schedules and provide online learning programs as well. I would say that the healthcare professionals, the LBS MBA is actually great for healthcare professionals because of the right knowledge, the skills, and the networking that they get at the end of the program. Next, I'll be going into the 4 streams of MBA that we have. But because of the cost of this webinar, we'll be looking at the 3 streams of MBA that accommodate our schedules. The first one that we have is the full-time MBA. We have the modular MBA. We have the executive MBA, and then the modular executive MBA. Like we were talking about flexibility, the modular MBA is a flexible MBA that allows professionals still work and study, but it gives at least professionals with 3 years of work experience for this MBA that can apply for this MBA, 3 years of work experience that can apply for this MBA. The start date is January 2024. So the next one is for next year. We started one in January this year, and then application deadline is also in December 2023 of this year. So that would encourage that we start our application and start preparing to start our application for the modular MBA. The program fee is for 7.2 million, which is payable during the course of your program as well. We have you have opportunity to make your payments and have a payment structure that is convenient for you, because we understand financial issues sometimes can come up. Then also, while you want to apply for the MBA, there is also the entrance exam test that you have to take. So we have the GMAT, the GRA, or the NMAT test. The EMBA also is a weekend program for the middle to senior level managers with over 7 years of work experience. So because of COVID-19 and over time, we have seen that there's a need for flexibility in the EMBA. And so it's also flexible form of learning that you can also do an online study. It just requires you to come online, on site, like the MMBA as well, come on site for 1 week in 3 months. Within 3 months, you come for 1 week intensive session. And the EMBA starts in January 2024. The application deadline is also in December 2023. It's for 24 months, and then it's for 8.4 million. The entrance test that is required here is the LBS test. The LBS test is a GMAT standard test, but it's just an internal test conducted by the LBS team. And then the last one that we're looking at is the Modular Executive MBA. It's same as the EMBA, but it requires you online study with 1 week hybrid class every 2 months. And then the option for immersion trip is also involved. It start date for that is July 2023. As we speak, there are applications for that as we speak. And then the application deadline is for 30th, 2023. The duration is for 24 months as well, and it's 8.4 million. And then the LBS test is the entrance test that you need to take for that. Next, we'll be looking at the application process for our MBA. So first off is the online application. So while you want to apply for an MBA program, you start your application online with our also put in our website, registration.lbsmba.com. Then you can go there and start up your application. When you start your application, you would also schedule for an entrance exam, one of the ones that I mentioned earlier, depending on the program that you would like to come for. You also attach your supporting documents. Supporting documents are very important. Your transcripts, important, your resume, and if you're going to be sponsored as well, to require you to bring a sponsorship letter. You come to the interview stage. So we have the interview stage that our faculty team would be interviewing you to ensure that your goals, your career goals align with why you're coming for an MBA, and then the reasons you would like to come for an MBA as well. So you would be you'll be scheduled for an interview, which would later on go into verification to acceptance and enrollment, and then your admission decision as well. Then you hear from our admissions team on your decision of your admission. And next, we'll be going to we'll be going to what a day is like for an MBA student in LBS. So we understand that the MBA sort of does not give you time. It's very intense. And so it's required that students have like a time for them to properly structure their day, so it can be a productive day for them as well. So this is just an outline of what a day for an LBS MBA student looks like. And that's just that about that. The next slide talks about our accreditations and then our rankings. Our rankings are MBA. Also, very importantly, Lagos Business School MBA is the only MBA in West Africa accredited by AMBA. So that is that for the MBA team. I'll take questions and answer, of course. Thank you.
Thank you very much, Busayo. Thanks for the exhaustive presentation about the MBA. So just to recap, the full-time MBA, modular MBA, executive MBA, and also the modular executive MBA. I am looking through the charts to see if there are any questions specifically around the MBA program, the process. If anyone has any question, there was a question earlier in this session about if it's online. So I believe that has been answered. There is the program that allows primarily online with the intensive session where you come physically into the considering the average doctor cannot afford that. So please, Busayo, you have that question from Mayowa Ajao. Are there flexible payment plans considering the average doctor cannot afford the amount you put there? Please, Busayo.
Yes, please. There are flexible payment options, and then there are installment payment options. So are there flexible payment plans considering the average? Yes, please. It's allowed. We have installment payment options. So when you get for the MBA, as soon as you get your admission letter, you're required to pay a certain amount, which is 1.2 million. While for the EMBA and the MBA, you're required to pay 2 million, and then you will spread the remains during the course of your program. That's about 3 installments. Yes, please.
Thank you very much. There's also the question. Okay, there are 2 questions now. Is the scholarship option open to everyone? What's the procedure? And maybe just highlight again, what are the key differences between the different MBA programs? So, besides scholarship, Paul Okonkwo is asking about, is the scholarship option open to everyone, and what's the procedure?
Okay, so we get scholarships from different platforms. And of course, it comes for some of these institutions that give us scholarship for participants. It comes with their requirements. So we have few scholarships on board, but I would put them out shortly so that you'll see if you fit into any of these scholarships, and then you can apply. But one important thing is you have to have started your application process before you can even qualify for a scholarship. So you have to start your application, go through the entrance test, finish the LBS admission process before you can then apply for the second question.
Yes, the second question was around the key differences between the different MBA programs.
Okay, so the MBA program is, like I said, the full-time MBA is strictly on-site for participants with 3 years of work experience and above, while the MBA is for participants with 3 years of work experience and above, but is flexible. So it's an hybrid form of learning that requires you not to be fully on-site. EMBA as well is supposed to be like the full-time MBA, but we because of the COVID-19 happened, and then of course participants want it more flexible, and we have the EMBA in January while the member is in July. It is also same as the member as well. So it's an online, the EMBA is an hybrid class with 1 week on campus, 3 months, the same thing as the member. The difference between the member is that it's every 2 months, while the EMBA is every 3 months for you to come on campus.
Okay, thank you very much. So I think just to highlight again, one key question you want to ask is: do I have more than 3 years experience? Do I have less than 7 years experience? Then full-time and the modular MBA. If you have more than 7, you're looking at the executive MBA and the modular EMBA.
Yes.
Thank you very much. I think that is it concerning questions around the MBA program.
Okay.
As we wrap up, thank you very. Yes.
Sorry. Okay. So
okay.
Our registration link to start registration is in the chat room, so you can also go online and then get more information. We have our contacts there to reach out to us if you have a need for more clarification. Thank you.
Thank you very much. Thank you very much, Busayo. And we really want to appreciate everyone for maintaining great energy and great attention. We're running quite close to 2 hours on this so far, and it's exciting to see that the room is still quite full. So as we round off to give us the closing remarks, I am going to welcome Jacinta Nakwa, who is the head MBA program management in Lagos Business School. Jacinta, please.
Thank you, Dr. Dolapo. So on behalf of the Dean of Business School, the Associate Dean, the MBA Director, I would like to say a big thank you to our keynote speaker, Dr. Tosi Majikodumi, for the excellent delivery of his session, the keynote topic on the outline of changing landscape in the healthcare industry. We also want to thank our LBS alumni panel speakers, which is intentional, Dr. Olufumilola Esho, Dr. Uzodinma Ume, and Dr. Olayinka Olowojolu, our alumni moderator, Dr. Dolapo Amuson, for giving us good insights on the team from the Wardroom to the Boardroom. We sincerely appreciate your invaluable contribution to the session, as well as your MBA testimonials. We can't thank you enough for honoring our invitation, for the wealth of knowledge you shared with the attendees. We are very grateful for that. And the keynotes, everyone will agree with me that the keynote and panel sessions were quite insightful. And we sincerely hope you will oblige us when next we invite you. So to all our attendees in the healthcare profession, we thank you for being part of today's event. Your attendance is much appreciated, and we hope you enjoy the experience, and we look forward to welcoming you on the LBS, Lagos Business School MBA program. So our marketing team will follow up with you after this event. They'll reach out to you to respond to any questions at all that you might have regarding how to begin the admission process, and the expectations on the MBA program. So that will be given back to you in details, in addition to what Busayo had shared with everyone. And you all agree with me, just as the speakers have rightly mentioned, that business skills are very much needed in every organization, which also includes the medical profession. So please know that this is to our healthcare, all our healthcare professionals. Please know that the dedication you bring into your profession every day does not go unnoticed. We appreciate the hard work you put into keeping our community very safe. Thank you very much. And we hope to have more of you on the LBS MBA program. Do enjoy the rest of your evening.
Thank you very much. Thank you very much, everyone. As you exit, a survey will be presented to you. Possibly when you try to exit your Zoom, you can please fill in the form and give us some feedback. Thank you very much, everyone. Have a wonderful rest of the weekend.
My name is Chris Ugbeche, Professor of Strategic Management and the current Dean of the Lagos Business School. Let me take you on a journey.